Phase 1 is the acute phase, where the aim is to protect your foot, reduce pain and inflammation. Treatment methods include applying ice or cold therapy, massage, taping and wearing a night splint. Although we want to offload your foot during this stage, there are plenty of exercises you can be doing around the injury whilst it's settling. The length of time you'll be in phase 1 is pretty unpredictable, but you won't do well later in the program if you don't get through this period of acute irritation. The aim of phase 2 is to reduce pain significantly and allow a normal gait pattern with minimal discomfort. You'll know if the program is working as your early morning stiffness will now be much less than 3 minutes by the end of this phase. Here we will manage the load you put through your foot whilst you're recovering and try and return you to some of your normal function. However, single leg heel raisers may still be reasonably uncomfortable even as your strength improves. If your symptoms do not improve as you expect or we expect, or you do have a minor flare-up, go back to phase 1 just for a little while to let it settle back down again. The aim of phase 3 is to get you to a normal gait pattern with minimal discomfort and very little early morning stiffness. By the end of this phase, although your foot may feel a little tender and stiff, it will loosen to virtually nothing very quickly. You should be able to do a single leg heel raise with full power and confidence and minimal discomfort. The idea is to progress from low to high loading of your foot, but keep it low impact with the ground. As your functional strength improves, you can increase to perform exercises such as hopping and running up to 75% of your normal speed and acceleration. By the end of phase 4, you should be pain-free with a normal gait pattern and no early morning stiffness. You should be running at around about 100% speed and acceleration, including complex agility and sport-specific drills. In this phase, we take you from low to high impact and moderate to higher speed drills, increasing the load that your foot can tolerate on the ground. Phase 5 is the maintenance or injury mitigation phase. It's designed to help prevent your injury from returning. As you know, plantar fasciitis is such a difficult condition to treat and manage, so you really want to do as much as you can to prevent it happening again. It is wise and prudent to include some mobility, activation, movement control and strengthening exercises in your weekly training program, certainly for the next few months.